All right, thanks, Brett. Well, welcome everyone and good afternoon. Thanks for hopping on this week's update call with us. Been a busy week so far, and it's only Tuesday. And I think when you take a look at Jordan's data, you'll kind of understand what's going on. So, Jordan, I'll turn it over to you.
All right, thanks, Kevin. So as you guys can see, we only have two colors in our graphic this week, and they're both very high and highest for rankings of cases. So that means all of our counties are in risk level D or E. The counties that are in risk level E are Kalkaska, Missaukee, Newaygo, and Wexford. In Missaukee, Newaygo, and Wexford, there have been some larger outbreaks, and then there have been a couple smaller outbreaks in Kalkaska, and their numbers have been relatively low before now, so that can explain why they're now in a highest category. Many of our counties are either increasing or at a standstill right now for case trends. I think Oceana is the only one that has a declining attached to it, and that's only been for 6 days. So it shouldn't be a surprise that our daily cases per million and percent positivity have also increased for our jurisdiction this week. There were 375 new cases over the past week, and the week before that, there were 270 cases. So we have seen a 39% increase in cases when comparing those 2 weeks. The cases we have seen have been identified as household and community contact, school, including college and sports teams, religious services, recent travel, social gathering, some healthcare workers, and inpatient testing, jail exposures, and worksite exposures. Our total number of jurisdiction-wide cases as of yesterday was 12,422. And cases by county as of yesterday are Crawford with 588, Kalkaska 625, Lake 360, Manistee 764, Mason 1,174, Mecosta 1,969, with Ferris reporting 624 cases, Missaukee 743, Newaygo 2,875, Oceana 1,825, and Wexford 1,499. In the past week, we had 2 deaths reported and 188 people recover. Yesterday, there were 6 positive inpatient cases at Munson Healthcare Cadillac, 6 at Munson Grayling, 0 at Munson Manistee, 2 at Spectrum Health Big Rapids, 2 at Spectrum Health Gerber Memorial, and 0 at Spectrum Health Ludington. So now let me switch my screen over to the vaccine table. This is how our vaccine distribution is looking. District 10 has administered approximately 56.6% of the vaccines that have been given in our counties according to the state. So you can see that we have given 49,692 total doses. According to the state, 87,862 total doses have been given in our counties. And there have been 33,986 people who have completed their vaccine series, and that number does now include the J&J, so those won't match the second doses given in the county. I know last week they were kind of off by 1 or 2, and I did never receive an answer on why that might have been, but going forward, I don't think we'll have to worry about them matching anyways, because some entities have started giving J&J. Does anyone have questions?
All right, doesn't look like it. Okay, thanks, Ray, or thanks, Jordan. Jeez.
You're welcome.
All right. So as you'll see from Jordan's data, we are starting to experience some upward tick in cases across our jurisdiction. We do have some outbreaks going on in a number of our counties at multiple locations that we're trying to work on. So doing what we can to try to keep these in check as we move forward. We do know that we'll have spring break coming up here the end of this month and that first week in April. So we'll be watching, and hopefully we won't have a big influx of cases at that time. We do continue to do vaccination clinics in our jurisdiction. Mondays and Wednesdays and Fridays are first dose clinics, and then Saturdays have been second dose clinics. We are going to try to pivot away from the Saturday clinics and switch to more a schedule of first dose clinics being Tuesday and Wednesday, and second dose clinics being on Fridays, and looking to try and implement that towards the end of April is what we're hoping for. And so you'll be seeing more information. So that's why you may notice some changes in our clinic offerings. In addition to that, trying to utilize the Johnson & Johnson vaccine that we have with some of our homebound populations, some of our jail populations, and some of our more congregate living type facilities, homeless shelters, locations like that we'll be trying to utilize to get that vaccine into. But that type of clinic, those types of clinics are going to we'll have to work those in amongst our other larger clinics that we're doing. And unfortunately, with this uptick in cases, we're having to divert more staff to contact tracing and case investigation. It's taking away our ability to do those populations. So we are, we're going to do the best we can to get them up and going. So it's just going to probably take us a little bit longer. So thank you to the councils on aging and those other groups that have sent us lists of homebound populations. We are sharing them with our staff so that they can formulate plans to get out and begin to vaccinate those individuals. Again, like I said, it's just going to take us a little bit to get to everyone. You're probably aware that the vaccination guidance is going to be changing. And as of, I think it's the 22nd, the vaccination is going to, vaccination eligibility is going to open up to anyone 16 and older, provided they have specific health conditions or health concerns, health conditions that have a negative outcome associated with if they do become positive for COVID. And then by April 5th, it would be opened up to 16 and older, regardless of health conditions and across the board. So I'm not quite sure, and I mentioned this on another call I was on today, I'm not quite sure why they do this 2-week dance around with only those that have specific conditions. It does create it creates a ton of more logistical work for us and policing to some extent in trying to determine if people have health conditions or if they don't have health conditions. It really would be easier if they just went to an age-specific criteria across the board and just said, as of this date, 16 and up is going to be what we'll be vaccinating. So, I think internally we're still talking to see how this is going to work and how it's going to roll out. But I'm envisioning that we'll probably just, once we make this change, we're probably just going to go 16 and older across the board, and we'll begin vaccinating at that point. But we'll have more information coming out about that once our team has had a little more time to talk and kind of plan this out. The one thing with that 16 and 17-year-old individuals, obviously we're not sure what the interest level in getting vaccinated may be amongst that group. What we're finding from some of the other populations and hearing from some of those work sites and manufacturing locations are that younger population is not real interested in getting the vaccine. So not sure if we'll see that same thing once it truly does get opened up or not. We'll kind of have to watch that. Again, ultimately, what we're trying to do is get to that herd immunity percentage. I think the last percentage I saw was of the population that was currently vaccinated was about 35% maybe. And really for herd immunity, we need to get to that 80, 85, 90% vaccination rate to achieve that herd immunity and prevent the virus from being able to get a foothold in the community. So, we'll be working to try to get as many people vaccinated as we can, and hopefully get to that, to that point. Again, additional vaccine is expected to be coming into the state. I was on a call before this, and they're expecting, the availability of vaccine to be increasing here, both for Pfizer and Moderna, as well as the Johnson & Johnson vaccine this week and in coming weeks moving forward. And so there may be a change in the vaccination allocation process where the vaccines would be coming to the local health departments, and the local health departments would be kind of pushing that vaccine out to the different providers in their communities, as opposed to the way it's going now. So waiting to learn a little bit more about that. So, we'll keep you in the loop as we hear more about that. So that's kind of what we know on the vaccine front. And then the current epidemic order, we're getting a lot of inquiries from people wanting to plan for summer events and graduations and other types of things. And honestly, as best I only know the guidance through the current epidemic order, which is through the 19th of April, and really have no idea what it's going to involve after that. So as of the 20th. So while I can appreciate, people wanting to get planning in advance of their events, if you reach out and ask us, that's probably the response you're going to get from us right now. We've repeatedly, and we meaning local public health departments, have repeatedly asked for some guidance and direction in terms of where do we think this is going to go afterwards, and haven't necessarily gotten a whole lot of it right now, probably because even at the state level they're unsure as to what's going to happen. So again, our hope is that we're going to gradually continue to open things up, but I can't guarantee that or predict what that might be looking like as we continue to move forward. So that's some of the things that I have to share today. Again, associated with these outbreaks that we're starting to see now, we are encouraging those facilities to continue doing some rapid antigen testing and some confirmatory PCR testing with at least a number of individuals at these locations being swabbed so that we can test for some of the variants that are out there. We know the variants are around in the state, most likely in our community. We believe that some of the outbreaks are probably associated with the variant because of the speed that they've taken off, but we can't confirm that until we can get some additional testing done on those variants. And that does take a little bit longer. Unfortunately, we don't get those results back until the people are out of quarantine and may not know until the outbreak is over. So, but it still at least gives us an idea of what's going on within our community. So moving forward, we will continue, as I said, to do our vaccination clinics. We're putting more of our scheduling pieces out online so that individuals can go out there and pick a clinic and schedule their own appointment. We still do continue to work through our wait lists with the 65 plus population that we have, trying to get all of them in as best we can. And I talked a little bit about some of the issues we were running into with that population on last week's call. So just continuing to work through the list that we have, and as I said, trying to get everyone who's interested in getting a vaccine to be able to have a vaccine, whether that's through us or some of the other entities in the community. I know our FQHCs are starting to get vaccine, both Family Healthcare and Northern Michigan Health Services Incorporated getting vaccines, and they're starting to ramp up their clinics, both on site and through their mobile units that they have. Our hospitals are looking at standing up some additional clinics. So the pharmacy program through Meyer and Rite Aid is also getting additional vaccine directly through the federal government to increase vaccination efforts in the community. So, a number of additional vaccine opportunities are starting to sprout up. So again, hopefully anyone that is going to wishes to receive a vaccine is going to have an opportunity to get a vaccine here very, very shortly. So those are the question, or that's the information that I have to share today with you. Let me see. It looks like we have some questions. Ken?
Yeah. Kevin, Ken DeLott.
Yep.
I know there's some national ad campaigns going on, and I understood you when you were talking about making sure we get the vaccination out to everyone who wishes to have one. Are there strategies being employed to deal with the people who don't wish to have one? Is there a way to impact some of the anti-vax sentiment on a local level? Any strategies being employed for that?
I think within that population, probably similar to any other, with any other type of issue, you could probably split the group into a third strictly, a third are never going to take it and never have any interest in getting it. A third, possibly can be convinced of getting it. And then the other third, obviously, those are the ones that are going to take it. So, always, focusing in on those first two segments of that population, trying to entice them to get the vaccine. Some of with the guidance out there now that if individuals who are fully vaccinated, if they're exposed to individuals who are positive, they don't have to quarantine. Not sure necessarily that that's enough to entice someone to get the vaccine, but it is one of the benefits of getting it. We also know that the data is showing that while the vaccine may not be 100% effective in preventing infection, definitely for those individuals, it does reduce the severity of the infection and as well as the symptoms. So again, not sure if that's enough to convince everybody. And then for that last segment of the population that kind of already made up their mind that they're never going to get this, we just continue to provide them with the availability of vaccines, so that if by chance they were to change their mind, we're available to vaccinate them, and again, if they want to do that. I know the state is working on some specific campaigns. I know as part of a cross-jurisdictional sharing project that we have with the Central Michigan District Health Department and Mid-Michigan District Health Department, the three departments that our medical director, Dr. Morris, oversees. We're also working on some media pieces to try and focus in on that. We haven't, they're not quite done yet, so but once they are, we'll be rolling those out and see if that has any impact on it.
Thank you.
Yep. Any other, let's see, other questions that people may have? Nothing else today? Anybody on the phone?
Kevin, this is Carol Mills from CMH. I actually put something in the comment, but we have staff and clients that are requesting the J&J vaccine that don't meet the current restrictions for congregate living.
Yep.
Is there a way that you're ever going to run a J&J clinic so people know that that's the clinic, the one that they're getting? Because a lot of people can't travel that far. And the other thing is do you know if you're going to start a wait list for the people with disabilities age 16 and over, or is that going to be a go in and sign yourself up clinic?
I've been emailing back and forth with Rachel on that, and I think those are two populations that, whether it's a specific clinic we set up to work with them, or if it's kind of similar to what we're doing with the homebound population in working on some little pop-up clinics, But yeah, we will be, we will be working to get those groups, and I think they may. I thought I saw an email where maybe there had been some communication already, Carol, between your office and ours on this.
There's lots of communication. I don't know if it hit these two or not.
Okay.
So
But
yeah,
yeah,
I have, our client, we have a client base that we're trying to educate.
Yep.
And I want to try to get as many of them in before the general population can do this on April 5th. And so a lot of them don't have internet, they don't have transportation.
Yep.
We will have to transport them. So I need to do a coordination on who needs this, how do we get them signed up? And I'd like to try to get them scheduled where that is coordinated with our transportation availability. So we need to start working on that now. And so I need to kind of figure out how I could potentially get some vaccine slots for our clients.
Yep. Now let me connect with some of our staff, and I'll direct them to connect with you, Carol.
Okay, perfect. Thanks, Kevin.
Yep. Other questions?
Kevin, this is Lori Tubergen Clark at Newaygo Risa. I don't have a question, but I did put a comment in the chat that I just wanted to highlight for folks on the call. I just finalized with Michigan Department of Health and Human Services to be a pop-up location testing site. We're really concerned about spring break. So on Sunday, April 11, which is the Monday before people return to school and work following our spring break in Newaygo County, they will bring a team in and do pop-up COVID testing in a drive-through format in the parking lot at our Educational Services Center in Fremont. So MDHHS is going to send me a promotional flyer and some information that I'd love to send out to you. And our job collectively as leaders is to get that out to workplace, schools, families, any resident that might want to take advantage of that free pop-up testing.
Okay. If you want to send that to either Brett or myself, we can send that out to the group if you'd like, Lori.
Yeah, that'd be great. I don't have the flyer yet. They said I'd have it by close of business Thursday, so
Okay.
I will get it to you before the end of the week.
Okay. All right.
Thanks.
Yep. Other questions? Okay. If not, guys, that's all that I have for today. Thanks for taking time to hop on the call with us. We'll plan on getting back together again next week and sharing the information that we have at that time. If for some reason we need to reconvene or get the group together before that, we'll do that. Otherwise, thank you for meeting with us today, and everyone have a good day. Thank you, guys.
Thank you.
Hey, Jordan, do you have a minute?
Yeah, I can stay on, or
Okay,
if you want to
thank
give
you.
me a call.
If you can stay on, that's fine.